Medical care in the United States is a travesty. It is getting more and more attention, thankfully, to social media, to people taking to TikTok to discuss their medical bills. It is a travesty. Americans are drowning in medical debt. Even though about 49%, close to 50% of Americans have insurance through their employers, there's still a large percentage of Americans that have medical debt that their insurance does not cover, whether it's for diabetes medicine or surgeries that they need, life-saving surgeries, or any other additional medication. Because they have insurance doesn't necessarily mean that what they need for their health will actually be covered. And for those who don't even have insurance, what do? As a solo practitioner, for me to have insurance for my firm would be extremely, extremely expensive. Fortunately, I do not have any chronic conditions where I need to see the doctor monthly. But if I did, I would have to pay out of pocket, as I do for any prophylactic procedures like getting my teeth cleaned, going to the dentist. I pay out of pocket. A few years ago, I had to get a crown, paid out of pocket. I think it cost me around $4,000 for a crown and for a root canal. It was considered, I think, cosmetic under the insurance coding or something like that. It was something ridiculous that was considered elective, even though I wanted to chop my head off because of the pain because I needed the root canal. But that's a story for another day. But yes, the medical insurance scheme in America is bogus. And I wanted to come on here and discuss where are the most areas that are overlooked and where the United States can improve so that Americans aren't coming out of pocket spending tens of thousands of dollars for treatments, for medications that they need. This is the Legal Code, and on this channel we discuss a wide range of legal topics. Typically we discuss legal topics, but this is a little more dynamic issue, but I think it's still relevant to the audience who watches this channel. So if you like that sort of thing, please don't forget to like and subscribe and share with anyone else you think will find value. Also, I am a real life attorney, so if you would like the opportunity to meet with me one-on-one to discuss some legal concerns that you have, whether it's for your small business, estate planning, or you need to troubleshoot some areas, there's a link in the description box. Now, without further ado, let's discuss the medical industry in the United States and the high costs that Americans are having to contend with. The United States has many glorious things about it, but it also has many problems. One of them being medical care. The large share of the population is still uninsured, about 10% of the US, to the lowest life expectancy in the developed world, despite all of the advancements of technology and testing, medical testing, and facilities available. Underlying all of these problems is the high cost of medical care. But the issue is more complex than just greedy pharmaceutical industry. That is a large part of the problem that fuels the broken system that exists. Because at the helm of this medical industry ship are stakeholders who profit from the dysfunction in the system, whether that's the politicians, the doctors, the CEOs, the pharmaceutical companies, the hospitals. The list goes on and on. If you're a stakeholder, you benefit from this dysfunction, even if you're on the lower rung. The only ones who don't benefit are the Americans who are paying the cost. The United States is the only profit-motivated healthcare system in the world. And perhaps it's no coincidence that it's also the most expensive healthcare system in the world, but with the most unhealthy population. The United States healthcare system is complex and convoluted, mostly due to the medical industry making aspects of the care market-driven. 3 or 4 areas are essential to tackle in order to address this crisis. One being high, unregulated prescription drug costs, administrative regulation, the lack of standardization with the administrative aspect, and that's dealing with billing and coding between and amongst hospital, as well as hospital care which is extremely expensive and accounts for 31% of the nation's healthcare costs. Another issue is that the US has the highest salaries for medical practitioners, whether that's doctors, nurses, specialists, than other Western nations. So we'll discuss each of these areas in this video. Now let's tackle pharma drugs. This always makes my blood boil because I see it as so unfair and unjust, and the government needs to just regulate this. This is the only way that this can alleviate the pressure that Americans are feeling. On average, Americans shell out about twice as much for pharmaceutical drugs than citizens of other industrialized, wealthy countries. High drug prices are the single biggest area of overspending in the US compared to Europe, where drug prices, they're government regulated, often based on the clinical benefit of the medication. So the higher the benefit, the more beneficial the medication, the government sees that, okay, we need to regulate this. We won't allow this to go up exponentially. With little regulation of drug prices in the US spends an average of $1,400 per person on medication compared to $749 on average spent by other prosperous countries. We're looking at Switzerland, Norway, Germany. Drug prices in the US are 256% of those in comparison to countries to other wealthy nations. In the US, private insurers can negotiate drug prices with manufacturers through services of pharmacy benefit managers. However, Medicare, which pays for a hefty percentage of national drug costs, is not permitted to negotiate prices with manufacturers. Makers of life-saving medications can price their products without restraint, and this has become a recipe for premature death for many people and chaos for Americans who need this medication. There's a demand for life-saving medicine. This somehow or another gives pharma carte blanche to raise the prices exponentially without any ceiling. The only competing market for Americans who refuse to participate in this model is to buy medicine overseas, travel to overseas, or hopefully they have friends and family who are traveling overseas in order to get the medication and bring it back to US land. But this is not an option for many. It's impossible for many. Therefore, there are no competing markets for life-saving medication. And when you're in crisis, how do you think about traveling to another country to get a life-saving medication? You need the resources, you need the support, you need the family support, you need contacts in those nations in order to get the proper medication that you need. You need to speak the language. So many dynamics that are at play that make it virtually impossible for many, but possible for the select few. Traveling to Canada for insulin, for instance, is something most Americans have begun doing and are doing more frequently. There's also been the adoption of those interactive websites to help people shop for lower price medicine. These have come about in the last decade or so, but these sites are not often fruitful, especially if the competing prices are still very high. Yes, it's competition, but it's still costly for the average person, and $15 difference between two competing insulin brands does not drive down the cost enough for it to really make a difference in the market. Also, these websites that were created to help people shop for coupons for the medicine, that is so demoralizing and insulting that you have to clip coupons for your medicine. And then it often makes little to no difference. And what's saved in a few dollars, you have to now deal with the added frustration, the anxiety, and the time that it takes to shop. It's just a nuisance. And to boot, the federal government was clever enough to make it illegal for bulk reimportation of drugs from Canada, but not to regulate medication costs. So the government does sometimes regulate some aspects of the medical industry, but not in terms of regulating in the way that it benefits the people who actually need the service. Another issue is administration costs. Administration costs add up. The largest component of U.S. medical spending is the cost of healthcare administration. About 1/3 of healthcare dollars spent in the United States pays for administration. Canada spends a fraction as much. Whole occupations exist in the United States that deal with medical coding, medical record coding, or whatever it may be, claims submission specialists that don't even exist in other countries. The key requirement for reducing administration costs is standardization. That's it. Making sure this is the same code for this procedure. That is it. That's all they would have to do in terms of standardization. If you're getting a triple bypass at this hospital, it's the same code for a triple bypass at this hospital in Kansas, in Hawaii. Everything is standardized. Just like when you go to the grocery store, you check out, it's simple because everything has a barcode on it. And credit card machines are all uniform. But every healthcare insurer requires a different barcode equivalent and payment system submission. So even in 2020, it's virtually impossible to send medical records from this hospital to this hospital that aren't affiliated. Almost all hospitals have electronic medical records, but there's no federal requirement that they're interfaced, that they're able to interact with one another. So they will require an overhaul of administrative efficiency to make sure the systems can speak to one another and speak the same language. This would dramatically reduce documentation, paperwork, and other bureaucratic tasks that patients, clinicians frequently have to deal with in order to offer care. U.S. doctors are the most likely to have the trouble getting their patients medication or treatment because of the restrictions on insurance coverage. Indeed, many providers take active steps to avoid electronic interchange because keeping the records localized ensures that fewer patients will shop around and switch doctors. So it's sort of like they strong arm the patient to stay with that doctor in order to avoid having to figure out how to send the medical records to another facility, even though that might mean better care for that patient. Standardization occurs when big participants decide they want it. In healthcare, the big participant is the government. The federal government has the buying power, has the bandwidth to impose an administrative system that forces the players and the providers to adopt a billing and interface system that is standardized. The federal government could commit to a date requiring all interactions within the medical system to have one system, one way of coding, and set up the infrastructure to make that happen. The government is the only one that could do this. To date, however, the public sector has shirked its responsibility. The federal government sees its role as just providing insurance to people vis-a-vis medical care, Medicare and Medicaid, but nothing more. They're not looking to improve systems as a whole and integrating the health and management and support teams communicating with one another on a patient's care. In an unintegrated system, which is what we have, there's lack of coordination, and that results in patients receiving duplicate tests, duplicate scans, unnecessary scans, redundancy, and this is more costly. This taxes the system even more. They're getting things that they don't even need for their care, all because things aren't standardized and there's no way to police it. The lack of standardization for service allows even prestigious hospitals to charge multiple times what a less prestigious hospital do for the same service. While that may be justified in case of a complex surgery or like neurosurgery, it surely is not for a simple x-ray. Another administrative concern is that employers have decided to raise costs for patients vis-a-vis their copays and high deductibles. So employers have figured out to reduce utilization, they will increase the cost of copays and high deductibles. This is really sneaky. So data from the Kaiser Foundation found that roughly 49% of Americans gets their insurance from their employer. That means nearly half of Americans don't have any autonomy in making a consumer decision about the cost of their insurance, because their employer already has determined what works for the employer, not necessarily for the employee and the staff. So employers, whether that's for-profit or not-for-profit organizations, they are incentivized to purchase more expensive health insurance plans because the amount the employer pays toward coverage is tax deductible for the organization and tax exempt for the employee. When an employer offers a formal healthcare benefit, the expense can generally be written off as a business expense. In addition, low deductibles or small copays encourage overuse of care, these employers think, so they don't want to do that. They do the inverse of making sure that they have high deductibles and high copays to discourage employees from seeking the doctors. So employers have it built in to discourage their employers from seeking health care by raising deductibles and copays. So they give you health insurance. Well, they don't really give it to you because you pay for it every 2 weeks or whatever it is in your paycheck. And then you still have to pay a high deductible, which engenders a relatively little price shopping and, if anything, more despondency for the average worker. Who came up with this? This is unconscionable. When I was working at a major Manhattan law firm with an address on 5th Avenue, offices nationally, 700 attorneys, thousands and thousands of staff, they came up with this scheme pre-COVID to increase the deductible, and they sold this. I mean, when they came, they had hold these conferences. Oh, we're implement this new insurance and it's going to benefit everybody. They had conferences, they ordered lunch for everybody and visited all the offices. Then they introduced their model of this new insurance program offered to the staff that said attorneys, partners making $400,000, $500,000, $600,000 a year will be paying the same deductible as a legal assistant making $72,000 or a records clerk making $30,000. The deductible was $2,500 universally. This was unconscionable and nearly caused riots in the office. The staff was pissed, but the attorneys, the partners making $500,000, $2,500 was a drop in the bucket. And we know attorneys are like one of the most unhealthy group of professionals out there. We're talking about overweight, obesity, suffering from alcohol addiction, drug addiction. So $2,500 was nothing to them. It was a drop in the bucket considering their health conditions that they had. But for the staff, this was dire. This was dire. But this is an example of how these companies railroad employees who are desperate. But what was the alternative for the employee? Not take the insurance and risk it? Hopefully they won't break their leg or need life-saving surgery or become diabetic. But this is an example. Also, what doctors do is encourage patients to affiliate with star hospitals that they have a relationship just because out of habit, patients are inclined to go to those hospitals that are affiliated with their doctors, even though they're not necessarily getting optimal care. So this is all the things that's going on in the background in terms of administration, which is why it is so costly and the biggest area that is draining the medical system in the US. Price regulation is not hard to implement. Thou shalt not charge higher than this for this type of procedure is not difficult. In fact, Maryland, the state of Maryland, does this for hospitals, and most European countries do this for pharmaceuticals. Now let's also talk about doctor utilization. We talked about this earlier in terms of how employers discourage utilization of the insurance. The policy that higher deductibles discourage utilizations isn't in fact a thing, but the actual numbers show that Americans do not frequent doctors like a cardiologist any more than any other demographic or any other national, and are not hospitalized any more frequently. But when they do go to the hospital, this is the issue, is that the treatment is more intensive vis-a-vis the imaging, the testing that are done. So despite the more intensive US cardiovascular care, heart attack survival is not any better in the US. In fact, US death rates for heart disease have been on the rise relative to other rich countries, despite the intensity of the testing and the treatment in the US. The greater degree of imaging in this country detects more. Let's also look at cancer. There's greater technology in the US with testing for cancer screening. And cancer screening is done more regularly and more aggressively in the US. Therefore, more cancer results appear, but does not necessarily correlate with survival. An article done by the New England Journal of Medicine in 2012 titled "The Effect of 3 Decades of Screening Mammography on Breast Cancer Incidence." Now, the abstract was to look at, to reduce mortality, screening must detect life-threatening disease at an earlier stage, more curable stage. Now, effective cancer screening programs, therefore, both increase the incidence of cancer detected at an early stage and decrease the incidence of cancer presenting at a late stage. Despite the substantial increase in the number of cases of early stage breast cancer detection, so more people are tested earlier in the earliest stage of cancer, the screening mammography, the conclusion came at was that the advanced testing does not necessarily lead to better outcomes for cancer. More people are tested and more people become diagnosed. The screening shows that it doesn't actually lead to better treatment and better outcomes in cancer survival. And it also leads to people who are overdiagnosed with cancer. The early screening at best only has a small effect on the rate of death from breast cancer. Another study, according to a study by the Journal of American Medical Association, showed that Americans tend to associate more advanced technology and newer procedures with better care, even if there's no actual concrete evidence that the more advanced testing and newer technologies are more effective. And there's no way for Americans to actually read this. How many people can read, have the time to read medical journals unless you are actually in that field? So despite the wealth of information at our fingertips online, there's no uniform way to understand treatment options and the cost of care. So it's like buying a car without doing research. None of us will ever do that. But the medical industry has been able to prevent Americans be able to discern what is actually better care than what has historically been used. This is how we buy healthcare, though. The Kaiser Health News reports that even when evidence shows that a treatment isn't effective or potentially harmful, it takes too long for that information to spread to the population and become accepted and change how doctors are practicing or what patients demand. So a lot of tests are done without it actually being an effective course of treatment. They call this defensive medicine. Some doctors will prescribe unnecessary tests for a type of treatment out of fear of facing a lawsuit. They will practice medicine in line with standard, generally accepted principles in the medical community, because any deviation can mean malpractice lawsuit, even if the deviation offers optimal care. We saw this with some doctors who were offering alternative methods to treat COVID, where doctors were railroaded because they weren't practicing or offering the standard care for COVID patients. So they were railroaded because they had an alternative treatment, even though this alternative treatment was effective and saving lives. And even as the United States does overdo high-tech care, it does not provide routine care or prophylactic care, preventative care. Effective medications to treat high blood pressure and high cholesterol have been around for decades, yet only half of the people with these risk factors are successfully treated. Mental illness is another undiagnosed, undertreated despite its enormous social cost. It's not sexy to bill for that, the way it is to bill for cardiovascular surgery. So the reason for the disparity between high-tech and routine care is not hard to figure out. Cardiac surgery and MRIs is lucrative and over-provided. This video is super long, so I'm going to cut it here, and the other information I'm just going to put in another video. All in all, I say that to say the United States spends significantly more in healthcare compared to other nations, but we do not have better outcomes. We do not have better healthcare outcomes, and there's so many reasons why. The profit-driven margin is destroying Americans. One other thing is that one of the most piercing revelations is that the high rate of expenditure for insurance is not commensurate with satisfaction of patients or quality of service. High out-of-pocket costs undermine efforts in the US to improve care coordination. So the solution, how do we fix this? I don't know if voting is necessarily the solution. It takes time for laws to be handed down to actually improve, for any new policies to come into place. The only feasible solution I see, the only way for Americans to have an immediate solution to this is medical tourism, which is what I will discuss in the next video. We can't fix medical coding, administrative costs, the cost of medicine. The only solution I see is to create a pipeline for medical tourism that will actually immediately help Americans. I'm going to get into that in my follow-up video regarding this. So let me know if you like this information. Let me know your interaction, your experience with medicine in the United States. Let me know, if you are an employee, how your employer schemes their medical coverage, if it offers it at all. All comments are welcome. This is a crisis. It affects all of us. So all comments are welcome. Don't forget to like and subscribe, and I will see you next time.